Hey guys, welcome to UMC's Nursing Education online C&E series. Just wanted you to know that this one will count as 1 hour towards your geriatric requirement from the Texas Board of Nursing. Before we get started, we just need to talk about your requirements for completion of the C&E activity. Okay, so first you watch the video, then take the short quiz on Moodle and pass it with an 80 or above, and then very important piece, make sure you complete your evaluation and then you'll be able to print your certificate. Also, very important when you're working in Moodle, make sure that you enroll in the course. And it's on the left side of your screen, you'll see a little button that says Enroll Me in this course. If you don't enroll, it will not give you credit at the end for having completed the course.
Well, we'll go ahead and get started. Good afternoon. Thank y'all for coming. I'm glad there's a good turnout. It's a little bit nerve-wracking though, but I hope I have some good information to share with you today that will impact the way you care for your patients and be meaningful to you and be worth the hour of your time that you spend here so that we can make a difference in the elderly patients that we take care of. So today we're looking at elder abuse and neglect, looking at the knowledge, assessment, and then most importantly, the intervention. Because we are providing a CE, I just want to make sure that you know that we have no bias or affiliation at this presentation. And you will be receiving one continuing education hour at the completion. So some objectives that we will be going over today. I want you to be able to differentiate the different forms of elder maltreatment, discuss the current research on the field of elder abuse and neglect, discuss some consequences of elder abuse and neglect, then maybe evaluate some methods for identifying victims, and then recall how our state law affects your care of abused and neglected elderly patients. So, define elder abuse. It has definitely become, it's currently defined as an intentional or negligent act that causes harm or increases the risk of harm to an older adult. At this point, it's commonly defined as age 65. Some laws are using age 60. As I get older, I'm a fan of, let's call that 65 or 70, but elderly patients, according to law, some laws, it's even the age of 60. It has definitely become a catch-all phrase for the various wrongs that are done against older people. Over the last 25 years, the research and understanding on the topic has increased dramatically, but you would be surprised what little research has actually been done on the topic. It's kind of crazy to think, as I was doing some research and digging, that it wasn't all that long ago that they were even debating if elder abuse existed. It wasn't even a topic on the radar till not that long ago. So that's when a major thrust of investigation was establishing just the existence of the problem that exists. And actually, as far as laws and different institutions that are working on elder abuse, they haven't gone into effect until in the last 15 years that we've really seen the majority of laws on elder abuse come into effect. So it's kind of wild to think that while we know it's been going on for many, many years, that it's just now becoming, I think, more discussed, more openly recognized. And that is why the state of Texas is saying that we should have completed at least 2 hours on the care of elderly patients, including the topic of elder abuse. So let's kind of differentiate the different types, because it is a catch-all phrase. So let's kind of talk about the different types that exist, because if we can identify the types, then it might stick in your brain a little bit better when you're taking care of your patients and when you're assessing them. That type of abuse is what it is. So first let's talk about elder neglect. Okay, so neglect means to fail to provide. Okay, so elder neglect is failure to provide of a caregiver to provide any part of his or her obligation or duties to a patient. That's a pretty all-encompassing statement, in my opinion. Failure to provide adequate nutrition. That is a form of elder neglect. It is not acceptable. Okay? failure to provide clothing, personal hygiene, safety, just failure to provide the right medications, medical treatment, or comfort for these patients, and omission of the needed care. We're not here to say perhaps elder neglect is not from a form of spite or meanness, what we think of abuse to be purposeful. Elder neglect may be they just omit the care that they need. They don't recognize it. If they have medical issues of their own, to provide that to their elderly family members, it may be very difficult. Okay, so then within elder neglect, you can have the self-neglect. So it's an older person who wants to live on their own. They don't want to go to a nursing home or some other type of care facility. So the inability of an older adult to arrange for what he or she needs to be safe, to provide the independent living that they so long for. Don't we all want to live independently till we're 95? Okay, that's what they want. But there's self-neglect that may occur. This is the most frequent situation reported to APS nationwide, and in some areas accounts for approximately 70% of the referrals in some research that was done. It makes sense that people are willing to report elder self-neglect. It doesn't look bad on them, so I think the reporting of it is higher. But as we'll see later, the reporting of the other types is just very complicated. Then we have elder physical abuse. Any type of physical force to a person that causes harm or injury to our elder patients. We see this includes any form of striking, shaking, pushing, pinching, slapping, burning, restraining. That wrongfully restraining is a form of elder physical abuse. So even thinking as nurses in our setting, any type of unnecessary restraint is a form of abuse. So we want to use restraints very cautiously and judiciously for our patients. The other type is elder emotional and psychological abuse. So that includes any type of verbal acts, berating, harassing, threatening, and then nonverbal acts such as isolating an older adult from family and friends. So isolating that older family member, and they come in and they haven't seen anyone in months, that is a form of abuse. Okay, it's not acceptable to isolate them. With the isolation, there's so many other barriers because when they're isolated, it's hard to find the neglect, the physical abuse, the emotional abuse. So when they come to us, it's really important that we're sensitive to this maltreatment because it may need to be reported or else it will go on. We may be the only time that we have an interaction with this patient to stop it. Then the other form of elder abuse that is becoming incredibly more recognized, and the dollar amounts that are getting abused, research is showing it's higher and higher, and that's financial exploitation. So you have stealing, misusing, or withholding funds or property, or controlling the decision-making about the use of funds. So that financial exploitation occurs, unfortunately, more than we would like it to. There's some research that was done. MetLife did some research that shows that it was indicated $2.6 billion were misused in elder financial exploitation, and that was in 2013. So that's one of the most recent studies done. That's a lot of money that's been exploited from our elderly population that have worked a lifetime. They lived through the Great Depression. They saved all that money, and then it's being exploited. It's heartbreaking. Up to 55% of financial abuse has been perpetrated by family members. So it's not just credit card companies finding older adults non-suspecting and abusing their lack of understanding. It's family members abusing their financial decisions. So if you're caring for a patient and there seems to be weird financial situations discussed in there, you might want to consider reporting that because it could be a form of elder abuse going on in extreme situations. there was a study done in UK, and again, finding the most current research, it's challenging because there's not as much out there as one would think. But one of the studies in 2006 done in a small area of the UK found that 13 houses were given away without the knowledge of the elder owner. I mean, it just seems unbelievable that you would just give away such property or sell property without the elder family member ever even knowing. The other unfortunate form of elder abuse is sexual abuse. That's any unwanted sexual contact, exploitation, rape, fondling, all of it, sexual abuse. So we'll talk about assessing the patients with these abuse states here in a minute. Now, there's different theories on how you define and categorize different forms of abuse. Margaret Hudson is one of the leaders in elder abuse research at this time. She does have a definition in the taxonomy system that she used. So you kind of differentiate if you have a problem, who the perpetrator is versus the setting, form, what was the motivation, and then what's the locus of harm. This helps to define and provide the taxonomy more for research purposes. So it is important that it gets defined and that it's agreed upon so that research can be done and be more accurate and pinpoint. Not everyone agrees with this taxonomy, but most all agree on the definitions that I went over: the sexual abuse, the financial abuse, neglect, self-neglect, and financial exploitations, all being the top 5 forms of elder abuse. Just some facts and figures that are out there right now. Abuse appears to occur most often in the domestic home situation. It also occurs in institutional settings such as long-term care facilities, nursing homes, or hospice. I don't think that's any new ground-shaking news to you, but it is estimated right now that 1 out of 10 older adults experience abuse or neglect by a caregiver each year. That's a lot. Some research is saying that is a very small estimate of the amount of abuse and neglect that is occurring to our elderly population today. So if we think 1 out of 10 grandmothers or grandparents are getting abused, even in this room, that's too many, right? So some other facts and figures here. 2/3 of elder abuse victims are women, while older adults who are African American, Latino, poor, and isolated are also disproportionately victimized. An elder with cognitive impairment is at greater risk for the abuse, such as financial exploitation. According to results from several small studies, about half of people with dementia suffer from abuse or neglect by their caregivers. Half of the patients that we take care of with dementia are statistically being abused or neglected by their caregivers. That's a lot of patients that we treat in the hospital setting, a lot of patients with dementia. So we need to be on high alert for signs and symptoms of abuse and neglect. Some other risk factors: you're at higher risk if you're over the age of 75. Shared living arrangements. So while a family may think they're doing the very best by letting their grandparent or their elderly family member share living situations, because of that, they are actually at higher risk of abuse or neglect. Those that are cognitively impaired, and if they have any type of disruptive behavior, they're at higher risk. Those that are socially isolated are at much higher risk. If the caregiver has mental illness, so if you have a patient and the caregiver that you know takes care of them comes in and they have a mental illness, the dependent is much more at risk for receiving abuse. And then if the caregiver has drug or alcohol dependencies, and if the caregiver is dependent on the older person. So often they're dependent on that Medicaid or Medicare check or that Social Security check or the financial security that the older person is providing, but so they're dependent on them, they're actually more at risk of neglect. Now, these same risk factors can be barriers to detect abuse because Not all patients who experience abuse readily demonstrate or express these risk factors. And conversely, not all patients with these risk factors are being abused, okay? You have to take it with a grain of salt, but statistically, these are the facts that we know of today. New research may emerge that finds other higher risk, but at this time, that's what we know. It does appear that it is certainly the prevalence is a growing problem, and I think we can recognize one of the reasons is that the population of those above the age of 65 is increasing disproportionately to the rest of the U.S. So we have a high proportion of elderly patients in the U.S. Adult Protective Services cases from 2000 to 2004, the investigated reports increased from 16.3%, or they increased by 16.3%, and then substantiated reports increased by 15.6%, just in that 4-year time frame. Okay, and that was in 2000. We also know that the geriatric proportion of the U.S. population is projected to increase from 12% to 31% of our population is going to be over the age of 65. So this is going to be an even bigger topic, an even bigger thing that we should recognize the importance of detecting, preventing, and taking care of these patients. So what are some signs and symptoms? This can be challenging because, again, these signs and symptoms can also indicate other issues, but from the research, there is definitely some valuable research that's showing these are some signs and symptoms. So obviously, physical abuse, you're going to see bruises, welts, lacerations, unexplainable fractures, sprains, dislocations, internal bleeding, pressure ulcers, burns, infection, dental erosion. You can see the poor hygiene if they've been neglected. So you can see the list there on the screen. Now, that can be challenging. We also have elderly patients who are have osteoporosis, so they're going to be more likely to have fractures with the fall. Okay, so we can't 100% say they come in with a fracture, they've been abused. Okay, you recognize that. It's going to be thorough assessment and recognizing you want to get a good story from the patient. You want to get good history from the patient to really see what's going on. With psychosocial and emotional effects of the abused patients, they're going to have mental status changes, withdrawal. They'll be very aggressive, have lots of anger, confusion, or they'll just withdraw and have the lack of interest in socializing. A patient complaining that personal belongings are missing, they have unusual activity involving a patient's finances might be discussed or going on. And again, while these symptoms and signs may indicate abuse in the elderly population, they could be caused from a lot of other things as well. So if we put the warning signs with the potential causes, let's start thinking, okay, so if they're going to have the bruises, the pressure marks, the broken bones, abrasions, or burns, it would make sense that that's a form of physical abuse, neglect, or maltreatment. If they're going to have the withdrawal that's unexplained from normal activities, they've got just new onset depression that's not normally explainable, and their change in alertness occurs, then it would be potentially emotional abuse going on there. If they have any form of bruising around the breast, genitalia, then it would be sexual abuse. A sudden change in financial status, so all of a sudden that changes, you might consider the financial exploitation that might be occurring. Bed sores, unattended medical needs, poor hygiene, unusual weight loss, it's a form of neglect, which is a form of abuse. If the caregiver seems highly controlling spouses, they're belittling them, they're threatening them, it's verbal or emotional abuse. Okay? If we witness verbal abuse, that belittling, it's not acceptable and we need to report it. Okay? Frequent arguments between caregiver or adult, there's tense relations, it could be emotional abuse going on. And this exact source came from the National Center on Elder Abuse, and this website is full of information and helpful information for patients, caregivers, and for healthcare providers as well. It's a great source. So when you're assessing your patient, you can't jump to conclusions. Certainly that would not be prudent. But if injuries are present, you want to document all injuries that you're seeing, but also document what the patient is telling you about the injury that's expressed, and document what the caregiver says about how the signs and symptoms were sustained. I think we're used to doing this with kids that come in with injuries. I think we're a little bit more high alert of child abuse, but the same should happen for our elderly patients. If they just said, well, they fell. Okay, ask more open-ended questions. Let's get a good evaluation of what's going on. Observe the interaction between the caregiver and the patient. Sometimes our gut instincts are wrong, but if you're getting a gut instinct that there's some inappropriate relation going on, it seems odd, if you do good faith reporting, there's nothing wrong with that. Good faith reporting is, you're protected by law. I've been looking into this because there are some validated screening tools for elder abuse, and there are different tools that exist, so I want to show some of these to you. I don't know that I'm going to pronounce one of them correctly. I'm thinking that it's the Haylik-Singstock Elder Abuse Screening Test. Then there's the Danger Assessment Tool, and then there's the Elder Abuse Suspicion Index. These three tools are being used by some hospitals nationwide. Some of them are showing to predict abuse and neglect. So let's look at one of these here. This is an example of some of the questions found in the Haylik-Singstock Elder Abuse Screening Tool. So some of the questions that are asked in there: do you have anyone who spends time with you, taking you shopping or to the doctor? So you're kind of starting to ask, are you having the interaction? Are you helping to support someone? That answers the question if a dependent is dependent upon an elderly patient. So you can see these questions on here. Are you sad or lonely often? In parentheses, or the ones in brackets, are the questions that indicate potential abuse, or they're at higher risk for abuse. And then items 1, 6, 12, you can see the yes means one thing, the no means no to some, or let me clarify. Yes may show abuse on some, where no may show abuse on some of the other questions. So there's some institutions that are utilizing this elder abuse screening test to heighten the caregiver's alertness to this. The other tool that has been used by some facilities is the Elder Abuse Suspicion Index. And this is actually developed to raise a doctor's suspicions about elder abuse to a level that might be reasonable to propose a little bit more investigation. So these are some of the questions that may be asked. Have you relied on people for any of the following? Bathing, dressing, shopping, banking, or meals? So you kind of start to dig down deeper to what's going on with the patient. Another one of the examples, has anyone tried to force you to sign papers or use your money against your will? So these questions that we may not think of being important when you're doing a head-to-toe assessment might potentially be very important to the health care of our patients. So these tools are out there, and the validity of them has been studied and is still under question, because the U.S. Preventative Service Task Force, which was a big task force that was put together by Congress looking at elder abuse, found that there is current evidence is insufficient to assess the balance of harms and the benefits from screening all older or vulnerable adults from abuse or neglect. So at this time, that preventative task force says there does not appear to be supportive evidence that screening and early detection of elder abuse and neglect reduce exposure to abuse or reduces the physical or mental harm from abuse. So that task force is not for these screening tools. However, there are other different bodies that do support it. The Joint Commission does, the National Center of Elder Abuse, National Academy of Sciences, the National Gerontological Nurses Association. Those are just a few that I found that are supporting the use of certain types of elder abuse screening tools. And then the American Medical Association recommends routine inquiry. They do not specify certain tools, they just say we should be doing routine inquiry. So there are tools still in development, so know that that might be a coming thing as the field develops and grows, so that maybe we can help these patients. Okay, so let's look at a scenario that's unfortunately very common, and I might ask y'all a few questions out here. So this scenario, John and Evelyn live in a small house in South Texas. John is 85 and Evelyn is 82. They live together alone with their 2 small dogs and 1 cat. Their daughter lives nearby and decided that all the stuff her mom had collected over the years, all that stuff, it was hazardous, and the dogs were a tripping concern. Those little yipping dogs were going to trip her mother. While the parents were out, the daughter cleaned out many things, threw out a bunch of stuff, threw it all away. And after repeatedly asking her not to clean out their things, the daughter snuck in one day, took the dogs, and gave them away. The parents were devastated, and they had the locks changed. Not deterred by this action, the daughter broke the window, got inside the house, and threatened to send them to a nursing home if they ever locked her out again. When they disagreed, she struck her mother. This happens all the time. Do you think they're going to report this? No. I mean, it's so sad because that's the daughter that they love and cared for. And even in reading this scenario, her initial thought may have been the care of her mother. Well, that dog's going to trip them. All that stuff, it's going to catch on fire. Well, that dog is precious to them, or those dogs are precious to them. All that stuff they've gathered over their lifetime, and it's important to them. It's very convoluted and a difficult task for adult protective services when they get involved. The different litigation that gets involved here. Are her actions justified? No. It doesn't matter, even if it came from a good place about thinking the dogs were going to trip her. A daughter does not, no one has the ability to steal. That's a crime, okay? When you define it as theft, you can recognize easily as a crime. Was she legitimately concerned about her safety? Yes. So what's probably needed in these complex situations like this is family counseling, and both the victim and the offender may need counseling, but there are no easy answers in this situation. So you can see that this happens all the time, and again, it's very complex. So just be aware of these complex situations that occur at this time. There is an article from the Journal of American Society on Aging that was very interesting to read. It was called The Policy Implications of Recognizing that Caregiver Stress is Not the Primary Cause of Elder Abuse. In the 80s, there was tons of monies, research, and emphasis put on reducing the stress of the caregiver. It sounded, when it came from that, it sounded very, you could see where they were coming from in that research. They wanted to stop the elder abuse. Well, let's say it's the caregivers that are so stressed, that's why they're doing it. But it was very concerning because we don't say that a child gets beaten because their mother is too stressed, right? We recognize that it is never acceptable for a child to be beaten. But somehow, in the course of the research, there was this emphasis put that it was somehow almost the fault of the older adult causing this increased burden and stress on their caregiver. So in this research, in this article, it really focuses on the fact that we've got to get away from that concept. It's not caregiver stress that is the cause of elder abuse. In the 1980s, researchers faced significant challenges. They were trying to study a problem that was rarely discussed and very poorly understood. Baseline data on elder abuse was uncommon, the sample sizes were often small, and quite honestly, older abuse victims didn't want to be interviewed about abuse. That's their daughter or their son or their grandchild or someone that they care for and love that's abusing them. It's very complex. And then again, many studies were citing that caregiver stress as the culprit. And so a lot of emphasis, monies were put on reducing that. From caregiver stress to taking care of the patient. So, and more money's put to that. It's definitely, one of the quotes that they said was, as a society, it is time for us to respond to cases of elder abuse with the outcry and outrage we see when the victim is a child or a pet. Too often with elder abuse cases, there is only silence. When we continue to perceive elder abuse as a family problem or stressed caregivers, we focus on remedies that do not work, and it's a social injustice. So excuses. Abusers often lie, they excuse their behavior, they minimize the violence, and they blame the victim, and they can justify their actions. Well, she's too hard to care for. I was doing the best I could. She just falls all the time. I had to defend myself. See this scratch? See what she does to me? I'm the one that's the victim here. Do you know what I have to deal with since she is living here? I deserve that check because I give the care. These excuses are incorrect, inappropriate. We must stand against these injustices. So, as a society, as nurses here today, we've got to recognize that behaviors such as sexual abuse in nursing homes, threatening an older adult with a weapon, stealing money or possessions, they are crimes, criminal acts, not the result of a caregiver who could not handle stress. And while there may be debate on the taxonomy, different screening tools, the way that it's going to be explained, one thing is very clear for all of us here today. In suspected cases of abuse, complete and mandatory reporting must be done in according to our facility protocol, so we must follow our policy. There is a great resource out there on the Texas Attorney General page that breaks down how you are to report elder abuse. And I'm sorry if some of you can't see this in the back. There are different reporting lines that should be used. If you suspect abuse, you can always call the Adult Protective Services, and that is the 1-800 number for Adult Protective Services. If you are concerned that there is abuse in a nursing home setting, there is another phone line that can be contacted for that. If you're suspecting Medicaid funded facilities of abuse, there is a phone number for that. Any of these resources, if you call to report abuse and you find that it is the incorrect place to report it, they will guide you to the correct reporting agency. The most important thing to recognize is that as long as you follow facility protocol, you are protected, okay? I will not go into specifics about UMC protocol since it's a C&E, but just know that we need to look at our policies and procedures here to know exactly the reporting process. Your socials, your case managers and social workers on your unit can be of great assistance as well. There is also the Administration on Aging's National Center on Elder Abuse website. It's a comprehensive online resource that's available for elder abuse information and mandatory reporting requirements. And it also lists local contact phone numbers, different agencies that have local and state levels, and it's all there on this webpage. So it's very, very useful, user-friendly. If you have any questions, you can always go to this webpage. There was a 12-year retrospective study that was done. This study concluded that elder abuse is pervasive. It's a seriously detrimental experience that appears to affect the mortality and disability of our patients. Current research adds to the growing body of literature that suggests that abuse in the older adult precedes early death, and this study showed that for the first time provides evidence that abuse in older ages also precedes disability. So while we know that, all the data is showing that abuse and neglect increase mortality and morbidity greatly. With the act that was put into effect, there was a movement to broaden the focus from elder abuse prevention to the promotion of elder justice. And this first became law in 2010. The term elder justice is defined by law to mean, as you see on the screen there, from a societal perspective, efforts to prevent, detect, treat, intervene in, and prosecute elder abuse, neglect, and exploitation. So you can see that this Elder Justice Act that hasn't been in effect all that long, just a few years, is starting to move the justice movement in the right direction. The Elder Justice Act was passed as part of the Affordable Health Care Act, and it authorizes federal response to elder abuse. Now there is a lot more money that's being put into training, services, and different programs that are out there. Because we know that this problem has been growing, certain agencies such as Adult Protective Services, they were in great need of funds to investigate these issues that are going on. So this act is helping to fund those services that are provided. So in that way, the Elder Justice Act has been good to provide those different service organizations with the funds to do this. With the Elder Justice Act, it provides grants and incentive for long-term care staffing to use the electronic medical record technology grant programs that will collect and disseminate annual data related to elder abuse from the Adult Protective Services. And because of the Elder Justice Act, it authorized over $777 million in funding over 4 years. And it was very important because these Adult Protective Services were stretched thin, so hopefully this act has provided the resources to bolster their services to victims and help take care of these elderly patients. As we close here, I just want to recognize, and hopefully this has been a little bit eye-opening on the increased incidence and prevalence of elder abuse, hopefully make you realize that you can make a difference. It's very important that we assess our patients fully and accurately for these signs and symptoms of elder abuse. So thank you. We would ask that you complete your SurveyMonkey evaluation at the end.